Hello and welcome to In Depth, our show that looks beyond the news and focuses on who's of the time. Now, as India eases up the lockdown, as malls, hotels and religious places open up for the first time in over 2 months, the fact also is India's COVID-19 tally is continuing to increase at a rapid pace. Today, it stood at around 2,58,000. But barely 5 days back, it had just breached the 2 lakh threshold. So why do these numbers continue to scale up? And the bigger question, why is the country not testing enough? Are we simply unwilling to go through the tortuous process of tracing and testing? The debate on testing has been going on since the outbreak reached India. Conventional wisdom says the more you test, the more chances of finding positive patients, and then your numbers tend to rise. The flip side, of course, is it enables you to ensure that the infection can be controlled. Remember, even till date, India still has one of the lowest rates of testing amidst countries with high rates of infection. So let's take a look first at just how many people are we testing. Today, our focus on In Depth is the testing challenge around Corona.
While the Indian Council for Medical Research's website claims over 47 lakh tests have been conducted for coronavirus in the country, it has still not helped stem the rapid rise of infections. India's caseload continues to rise, and the coronavirus curve refuses to flatten. And amid growing cases, states continue to change the norms about who can get tested, when, and who must not be tested. Though Delhi seems to fare well in the battle against COVID-19, it has fewer cases than Maharashtra and Tamil Nadu and fewer deaths than Maharashtra or Gujarat. But proportionate to its population, Delhi's infection caseload is high. Delhi claims to have conducted over 2,51,000 tests till now. That's one of the highest in the country. But it has still not been able to control the spread of the virus. In Mumbai, BMC's testing guidelines now allow all direct risk contacts of a COVID-positive case to be tested after the 5th day, and no prescription is needed. The rules also claim if a patient is symptomatic, then the tests can be conducted earlier. Mumbai, the city that accounts for almost 20% of all coronavirus positive cases in India, has been under the scrutiny for its stagnant number of testing.
According to the BMC, in last 2 months, more than 2 lakh tests have been conducted, bringing down the average test rate to 16,000 tests per million. Also, another question has been raised that why has the number come down so significantly? Now, according to the BMC, this is because of the changed guidelines by the ICMR. Earlier, before a positive patient was discharged, 2 tests had to be conducted. That has now been brought down to just 1 test. Also, earlier, every pregnant woman had to undergo a COVID test. That is not the case anymore.
While the ICMR plans to scale up testing from 1.5 lakh tests per day to 2 lakh per day by June end, it is clear states across the country are not following the mantra of aggressive testing. Only a handful of states like Karnataka, Rajasthan and West Bengal have significantly ramped up testing in the last week of May, while many like Bihar and UP are conducting far too few tests.
We'll come in a moment to the variations that we are finding from state to state when it comes to testing. But there are other dimensions to this issue as well. Today, the Delhi High Court issued a notice to the Delhi government and the Indian Council for Medical Research seeking an explanation on their suggestion or their decision to exclude asymptomatic contacts of confirmed cases and only focus on symptomatic cases for COVID-19 testing. That matter is now listed for further hearing on June 22nd. But it does reignite the debate. Who should be tested? Should you only test those who are severely ill or facing serious symptoms, or do you test randomly asymptomatic patients as well? Where did the controversy begin? Watch this report.
The Delhi government has issued show-cause notices to private labs in capital for testing asymptomatic people for COVID-19. The private labs have been accused of going against the guidelines issued by Indian Council for Medical Research. The Delhi government says that the labs were doing around 6,000 odd tests on a daily basis, putting extra load on city's health infrastructure. The movement has sparked off a massive debate, as asymptomatic patients can be carriers of the virus that can be passed on to those who are more vulnerable.
Asymptomatic cases are also silent cases. They can have silent hypoxia. They can have silent CT changes, CT scan changes in the chest. They can also have sudden cardiac death. There is no way they can be left in the public.
According to ICMR, only symptomatic patients with travel history, those who are contacts of COVID-positive patients and symptomatic healthcare workers must be tested. Patients with severe respiratory infections, high-risk contacts of COVID patients, symptomatic patients within hotspots, hospitalized patients who develop symptoms and migrants who are symptomatic also need to be tested.
So if they are not spreading the disease, if you cannot take public health actions, I really do not see the reason why you should be testing asymptomatic people. So I think ICMR is right in terms of their current position in terms of testing only symptomatics.
With COVID-19 cases in India hitting the 2 lakh mark, the ICMR is planning to scale up testing from 1.5 lakh tests per day to 2 lakh tests per day by June end. At a time when country has begun opening up after an extended lockdown, will the strategy to not test asymptomatic patients prove counterproductive? With Milan Sharma in New Delhi, Bureau Report, India Today.
So what are the ground challenges when it comes to testing for COVID-19 patients? I'm joined by Dr. Harsh Mahajan, Chairman Caring DX, a lab which is testing for COVID-19. He's also founder of Mahajan Imaging, which has several branches across the national capital. Thanks very much, Dr. Mahajan, for joining me. Give us a sense, what do you believe is the big challenge when it comes to testing for COVID-19? Why has this become such a contentious, controversial issue?
Thank you, Rajdeep, for inviting me. There are several challenges which, if you see in the last 3 months, have been overcome to a large extent. From a handful of tests that were done in the beginning, we are now nearly at 1.5 lakhs a day, and the next target is 2. And we also know that the target beyond that is 5 lakhs. In the beginning, the problem was availability of good quality test kits. That actually has been overcome by indigenous development of test kits, as well as free availability of test kits to be imported from abroad. And I've in the evening checked up with the manufacturers, and they can supply whatever we need. Whether we need 5 lakhs a day, they can easily ramp up to that number. So that is something which has been overcome. The other problem was labs. The government labs have been ramped up, and there are over 200 now. And similarly, in the private field also, there are about close to 120, 130 labs, increasing every day. These had to be NABL accredited labs which were testing for H1N1. And since the procedure is same, this was replicated for COVID-19. And NABL, I can tell you, has gone out of its way to do online accreditation. Our own lab, which was for next-gen sequencing for cancer, but it had the RT-PCR equipments, it took us barely 5 days to get accredited for COVID-19. In fact, credit to the people who actually examined us, that from 6 in the evening till 12 at night, online, they saw everything, and within 2 to 3 days, the lab got accredited. contamination. So that is another area that's been overcome. The main problem actually has been of sample collection, because you're going into homes of people, that is what the private labs are doing, and collecting the samples individually. So the person going to collect it has to wear a full PPE. He has to go to the patient's house, take the sample from the nasopharynx as well as from the throat, and then bring it. They face challenges in that when you go into a society wearing all that paraphernalia, it creates panic in the society, and many people were not let in. Also, there is a kind of stigma that has got attached to the house or to the person where this sample is being taken. In fact, there are stamps which are put outside the homes saying that this is a home which has a corona patient. And that has been a problem. Then to ramp up numbers, even though we have the RT-PCR machines across the country, extraction of the RNA, the viral RNA from the swab itself is actually by and large a manual procedure. There are some large labs which have automatic extraction machines, but generally it is manual. And that, even if your machine can take 96 samples at one time, because it takes so long extracting it manually, you're putting in only 36 or 48 samples, and that is a constraint. Another constraint has been the paperwork associated with collection as well as testing of each sample. The RT-PCR itself is not a bottleneck. You can put 96 samples together and get a report in about 2 hours, but the whole build-up to it is the problem. So the kits are not a problem, the machines are not a problem, but it's the whole process which is limiting, even though it has been ramped up to 1.5 lakhs and we'll go to 2 lakhs, but that is where really the constraints are.
Let me put up the graphic of state-by-state testing analysis, and what we find is certain states have done remarkably well in terms of just ramping up their testing. We are seeing it in states like Andhra Pradesh, we are seeing it in Delhi, we've seen it to some extent in Mumbai, where per million at least the number of tests have been higher. But we are seeing other states which are falling back when it comes to testing. So what explains the wide variation? Do you believe that there is a general reluctance on the part of the of administrations to test more, because when you test more, you'll get more you could get more positive cases, and the rising numbers frighten in a way many state leaderships?
I think that is a self-defeating argument, because if we test more and pick up more who are having the disease, we can actually isolate them, we can treat them, and hence control the disease. Hiding numbers is not going to help, because the virus doesn't know that you're hiding numbers and it's not supposed to go everywhere. It's going to go where it's going to go. I think the problem in this asymmetry of testing within the country is because we don't have so many labs, molecular diagnostic labs in many parts of the country, in tier 2, tier 3 cities in the hinterland. And because of that, there is this asymmetry. This also, actually, I can tell you, state governments are attempting to overcome this, this shortcoming by sending samples to large labs, chains of labs, where, a chain may have 600, 800 collection centers. The problem there also has been that at every district level, you have to go to the DM and seek permission. A lab sitting in Delhi, which is capable of doing, say, 5,000 tests a day, is able to do only 2,000, because you have to go to every district, to the DM, seek his permission. Then you start thinking of how to develop the system for collecting the samples. And this is where there has been a thought that the smaller labs that already exist in these areas, they may be allowed to tie up with these larger labs. Of course, one would have to look at quality, but even just for collecting the samples, if those smaller labs are permitted, then it would be much easier to get those samples from even tier 2, tier 3, and even rural areas.
Right.
the governments themselves also, through their own network, are trying to pick up samples and send to these larger labs, as well as both government as well as private. So this is where I think, through the collection center concept, we can actually provide more testing in the rural areas where the migrants have now gone,
right,
and it's expected that there would be upsurge of disease there.
That's a very important point that you made there, Dr. Mahajan, the need perhaps to take testing not just from the focus on the big cities and the big labs, but take it into the hinterland, which could well become the next big challenge. Thank you very much, Dr. Mahajan, for putting the testing challenge in a way in some context for our viewers. Let's take a break at this point. When we are focusing on India's coronavirus testing challenge. Now, while the caseload in India continues to go up at an alarming rate and states are busy fighting the rampaging virus, politics is also being played at various levels, and testing has become a casualty. Take a look.
Steeply and consistently rising number of coronavirus cases, changing testing norms and low testing rates. Even amid such circumstances, politics has itself found a place. In the national capital, at a time when caseload is increasing exponentially and there's a need for expanding the test pool, Delhi has actually contracted it.
I mean, if there is someone who doubts and is in anxiety for that objective, I mean, he should be also given a chance. And when you call off the average and all, sir, Delhi is also among the first 3 states in the country today who are suffering the most.
But we are third highest in the country simply because we are testing so much. We are testing 11,000 people per million.
This came in the backdrop of Delhi government's FIR against Gangaram Hospital for allegedly flouting ICMR norms. On June 3rd, the Delhi government had asked Gangaram Hospital to stop testing for COVID-19, accusing it of testing asymptomatic patients in violation of government guidelines. In Mumbai, the city with almost 20% of all coronavirus positive cases in the country, there are allegations that the percentage of coronavirus tests has reduced by almost half in the month of May itself.
1 मई को महाराष्ट्र में जितने टेस्ट हुए उसमें से तकरीबन 56%, 56% टेस्ट ये अकेले मुंबई के थे, लेकिन आज जितने टेस्ट हो रहे हैं उसमें मात्र 27%, 27% टेस्ट ये मुंबई में लिए जा रहे हैं। मई महीने में 1 मई से 24 मई तक वो 32% है और 17 मई से 24 मई अगर हम देखें और उसमें यूनिक टेस्ट को अगर हम देखें तो तकरीबन 40% पॉजिटिव उसमें सैंपल में से पॉजिटिव केसेस निकली है। तो इसका मतलब यह है कि इन्फेक्शन बहुत बड़े पैमाने पर बढ़ रहा है और ऐसे समय मुंबई की टेस्ट को स्टैग्नेंट करना ये बिल्कुल गलत स्ट्रेटेजी होगी।
पहले दिन से महाराष्ट्र सरकार आईसीएमआर की गाइडलाइन हो, एमएचए की गाइडलाइन हो, पूरी तरह से उसका पालन करने का काम कर रही है और मुंबई मॉडल ही देश में एक सक्सेसफुल मॉडल होगा, इस तरह से आईसीएमआर ने कहा है। हमें लगता है देवेंद्र जी को बयान देने से पहले आईसीएमआर से पूछना चाहिए था कि महाराष्ट्र सरकार का मुंबई का कामकाज कैसा है।
Meanwhile, in Gujarat, where the mortality rate is second only to Maharashtra, the state government's decision to revise its testing policy is drawing flack. Gujarat government's new policy makes it mandatory for COVID suspects to get hospitalized if they want to get tested, thereby putting tremendous strain on the already overstrained healthcare facilities. Discrepancies in testing protocols in states across the nation comes in as the centre has provided a broad roadmap for testing and lifting of the lockdown. But the onus mainly lies with the states to take a call. And while the move gives more maneuverability to the states, it also raises questions over the central government's preparedness and willingness to own up to the situation.
Now, it's well established that the more you test, the better the chances of controlling the spread of COVID-2 virus. I know there are certain countries like Japan which have decided that they will test only the sickest. But what are the different kinds of tests being used to detect the virus? Let's take a look.
The current gold standard for COVID-19 diagnosis is the real-time reverse transcription polymerase chain reaction-based test or RT-PCR. This test uses respiratory samples to look for the presence of genetic material of COVID-19. Currently, the WHO recommends this as the only method for laboratory confirmation of COVID-19 cases. The other type of test currently in use is a blood-based test that looks for antibodies to the virus. These simple test kits are based on detection of proteins from the COVID-19 virus in the blood or serum. Humans generate antibodies in response to an infection, and the test looks for those. In a pool test, about 5 samples from some cluster are clubbed together for a single test using an RT-PCR test kit. If the pooled specimen sample tests positive, then all samples in it will be tested individually.
That's it on this special show on testing. Remember, the testing challenge is still alive across the country. Thanks for watching. Bye for now.
Hi everyone, Preeti Chaudhary here. Hope you like this video. For latest news and analysis, like and subscribe to the India Today YouTube channel. And don't forget to press the bell icon to stay updated. Thank you for watching.